So good morning again. We're going to continue with our ECG session. Today we're gonna do heart rate. How to look at the ECG or a rhythm strip and get the rate, because that's important when you're seeing a patient, or if you are given a ECG or a rhythm strip. One of the things that you need to do is to get the heart rate. How fast is the patient's rate going? Um, the normal heart rate is between 60 and 100 beats per minute. So you have to know what's normal, because if you don't know what's normal, then you won't know what's abnormal. So the normal heart rate is 60 to 100 beats per minute. And when we talk about normal sinus rhythm, as we said before, normal sinus rhythm is a specific category of things. The heart rate should be between 60 and 100 beats per minute. The PR interval should be between 120 and 200 milliseconds. The QRS complex should be less than 110 milliseconds. Um, and the heart rate should be, again, between 60 and 100. So those are the things. And the P wave should be upright in leads 2, 3, and AVF. So those are the criterias for a normal sinus rhythm. Now, again, remember what we said. When you look at the ECG, it is grid. There's a number of grid on the ECG, and the gridding is important. So let me just go back and so if you look in this ECG paper, you can see in the background it's gridded. There are big grids. So every periodically you see these dense uh, lines going down vertically. Okay, so we call those the space between the grids. We call them the big blocks. Okay, and if you look closely, you can see that each big box have 5 small boxes inside there. Okay, so each big block have 5 small blocks. So the ECG paper is gridded, and if it's not gridded, you can't tell the rate. So it's gridded, and the dark lines represents big blocks. So the space from one dark line to the next is a big block. Next, there's another big block, another big block. Each big block has 5 small blocks uh, uh, inside. So let's go on to our rate. So this shows it much better. You see these dark vertical lines. The space between each dark vertical line is what we call a big block. Okay, and the each big block has 5 small blocks. The duration of a big block is 200 milliseconds, and the duration of a small block is 40 milliseconds, because you have 5 of them. Okay, so it's important to remember that initially. Now, when you're doing heart rate, all you have to do is look at what we call the RR interval. So the space from one R to the next R is what we call the RR interval. So all you have to do is look and see how many big blocks separates the RR interval. How many big blocks separates the RR interval? Again, the RR interval is the duration from one R wave to the next R wave. If you have one big block that separates the RR interval, so the space between each RR interval is one big block, the heart rate is 300. If you have two big blocks between the RR interval, then the heart rate is 150. So to get the heart rate, heart rate is equal to, so heart rate, and the abbreviation for that is HR. So heart rate is equal to 300 divided by the number of big blocks. So it's the heart 300 divided by the number of big blocks. Okay, all right, so once you can find the number of big blocks between the RR, you just 300 divided by that and you get the heart rate. Okay, so if it's two big blocks, the heart rate is 300 divided by 2, which is 150. So I think that's relatively simple. So you should be able to determine the heart rate on everything, and on all the rhythm strips or ECG that you come across. So let's look at this one. Okay, so again, this is a R wave right here. This is a R wave. This is a R wave. That's a R wave. Okay, so we call the whole thing the QRS complex. But remember, the R wave is the initial upward deflection. The S wave is the second downward deflection. So so you probably have a tiny Q wave right there. Then you have your R wave, then your S wave. So let's count it. And it doesn't have to be exact, but if this falls right there, this is 1, 2, 3. So we have three big blocks between the RR. So the heart rate would be 300 divided by 3. So the heart rate would be 100. So again, if this is right there, then this is 1, 2, roughly 3. So it's roughly 3 big blocks that separates the RR interval. And the heart rate is 300 divided by the number of big blocks. Okay? So if the RR interval, if you have 4 big blocks separating the RR interval, then the heart rate is 300 divided by 4, which is 75. If you have 5 big blocks separating the RR interval, then the heart rate is 300 divided by 5, which is equal to 60. And if you have 6 big blocks, then the heart rate is 300 divided by 6, which is equal to 50. So you should be able to determine the heart rate in any scenario. And it's going to be an approximation unless the heart wave falls directly on the big blocks. Okay? It's important to note that the duration of each big block is 200 milliseconds, which is 0.2 seconds. Okay? So the duration of a big block is 200 milliseconds, which is the same thing as 0.2 seconds. And the duration of the small block is 40 milliseconds or 0.04 seconds. Okay? And again, the formula for heart rate is 300 divided by the number of big blocks between the RR interval. So heart rate is not that difficult. So remember when we talk about the heart, we said the heart is a muscular pump, okay? And we went over the anatomy of the walls, but it has an electrical system. And the reason why the heart pumps or contracts is because it has this electrical system which is constantly uh, stimulating the muscles, and then the muscles contract. If the electrical system is not working, the heart is not going to work properly. And the electrical system looks somewhat like this. If you remember what we said, the generator of the heart, the sinoatrial node, SA node, that's the generator of the heart, is at the junction of the superior vena cava and the right atrium. It's right there. Then you have some specialized fibers in the atrium that transmit the electric current to the AV node. So there's another power station right at the junction between the atrium and the ventricle. We'll call that the AV node right there. Then you have some specialized wiring. So if to get a good understanding, if you think about it in terms of wire, like how you'd wire your house or wire whatever. So you have a series of power stations, then these are wires. This specialized wire we call this the AV bundle, or the bundle of His. This is the bundle of His specialized wire that comes from the AV node. We call it the bundle of His. This bundle of His splits, and you get a left bundle branch and a right bundle branch. The left bundle branch divides into two specialized conduction system. We call one the anterior fascicle and the other one the posterior fascicle. So the left bundle splits into two, and you get an anterior fascicle and a posterior fascicle. Okay, so that's this is the left bundle branch, and it penetrates into the heart muscle to give you what we call Purkinje fibers. So these are the smaller wiring that goes into the heart muscle itself. And then this is what we call the right bundle branch. So you have a left bundle branch, or a left 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 bundle branch, and then this is the right bundle branch. Okay, the right bundle branch travels down into the muscle, and then it gives off these small wiring which we call Purkinje fibers. So that's the electrical uh, system of the heart, and we call that the conduction system. All right, so when you get so your electrical impulse is generated here. So this, and you don't need anything to cause this firing. This constantly fires. So from the day you were conceived, this SA node constant fire to stimulate the heart muscle, so the heart muscle pumps. So the electric impulse starts in the SA node, and then it travels through these special. There are some specialized wiring or conduction system in the atrium. Then it comes to the AV node. It slows a little bit. So when it gets to the AV node, it slows a little bit, and then it travels through the bundle of His right there. First, it travels through the left bundle branch, and then it goes to the right bundle branch. And then when it goes down these bundles, it goes to the Purkinje fibers, which are small little conduction system that penetrates the muscle itself. Remember that the left bundle branch has two fascicles. It has an anterior fascicle and a posterior fascicle. All right. So The electrical impulse originates in the SA node, and we call that the pacemaker of the heart. Again, you have to remember that the SA node is located at the junction of the superior vena cava and the right atrium. The electrical impulse travels through the atria to the AV node where the impulse is delayed, slowed. It's slowed down. Then it moves from the AV node to the bundle of His. So after the electrical impulse passes through the AV node, it travels to the bundle of His. After the bundle of His, you have what we call the bundle branches. You have the left bundle and the right bundle. The left bundle is divided into an anterior fascicle and a posterior fascicle. So the electrical impulse then travels to the left bundle branch and then the right bundle branch. So that is the normal transit of impulse. And then, as we said, the Purkinje fibers, the bundle branches tapers out to produce the Purkinje fibers, which penetrates the muscles and cause the muscles to contract. So stimulation of the His Purkinje system. So remember what we said about the QRS complex. The QRS complex represent depolarization of the ventricle. So it is stimulation of the His Purkinje system which brings that about. Remember that the His you have the bundle, the AV, you have the AV node, which is right at the junction of the atrium and the ventricle. Then after that, you have the bundle of His. So it is the His Purkinje system. So after you get to the His, then you have the bundle branches, the left and the right, and then the Purkinje fibers. So stimulation of this system produces the QRS complex because it is now in the ventricle itself. Remember, the AV node is right at the junction. After the AV node, you have the bundle of His. All right. So the next thing I should be talking to you about is the axis of the heart. Probably gonna wait a little bit to do that, but when we say the axis of the heart, it basically what is the average direction of the electrical activity throughout the ventricular activation. Basically, what we're saying, what direction the electrical impulse is traveling in. That's the axis. What direction the electrical impulse is traveling. And let me do a few things first, and then I'll come back to that. All right. So let's look at so I went over this. When we say sinus rhythm or normal sinus rhythm, what you're telling whoever you're communicating with is that the impulse starts in the sinoatrial node where it's supposed to start. And again, the SA node is at the junction of the right atrium and superior vena cava. What you're also telling them is that the heart rate is between 60 and 100 beats per minute. So that is normal sinus rhythm. You're also telling them that each P wave is followed by a QRS complex. Each P wave is followed by a QRS complex. You're also telling them that the PR interval is between 120 and 200 milliseconds, and you're telling them that the QRS complex is less than 120 milliseconds. So if you're going to say, if you look at an EKG or an ECG and you say this is normal sinus rhythm, you're saying a lot of things. So you have to make sure that what you're trying to communicate is what is actually on the ECG. So Normal sinus rhythm means the heart rate is between 60 and 100 beats per minute. Each P wave is followed by a QRS complex in a 1-to-1 ratio. The PR interval is between 120 and 200 milliseconds. The QRS complex is less than 120 milliseconds. And the final point is the P waves in leads 2, 3 AVF are upright. The P waves in leads 2, 3, and AVF are upright. So those are all the things that when you say normal sinus rhythm. So if you look at this ECG here, you can see, and this is the rhythm strip, okay? Of course, you see your big grids, okay? And each big block has 5 small blocks in between. So let's determine the rate. So you know you have this patient and you did the ECG, EKG, and you want to determine the rate. Remember, the heart rate is 300 divided by the number of big blocks separating the RR interval. So we usually use the rhythm strip for that. So this R wave falls right here, this R wave falls right there, this. So the space between, or the number of big blocks between the RR interval right here is 1, 2, 3, 4. And the heart rate formula is the number is 300 divided by the number of big blocks. So the heart rate for this ECG is 300 divided by 4, which is equal to 75. So this heart rate is 75 beats per minute. And if you look at the rhythm strip or the 12 lead ECG, you can see that each P wave is followed by a QRS complex in a 1-to-1 ratio. Each P wave is followed by a QRS complex in a 1-to-1 ratio. What we mean is that every time you have a P wave, you're going to have a QRS complex. And if you check, if you can check the PR interval, your PR interval here is about 200 milliseconds. It's about one big block. Remember, the duration of one big block is 0.2 seconds or 200 milliseconds. So, and then if you look at the P waves in leads 2, leads 3, and lead AVF, the P waves are upright. Okay? So the heart rate satisfies the normal sinus rhythm criteria. The upright P waves in leads 2, 3 AVF satisfy the criteria, and the PR interval and the QRS duration. The QRS duration is just how wide the QRS is, and it should be less than 120 milliseconds. And so, again, remember what we said, each tiny block is 40 milliseconds. So from the duration of the QRS complex, you can use lead 2. So it starts from there and it finishes about there. So it's about 2 tiny blocks. So the duration of the QRS complex is about 2 tiny blocks. So each tiny box is 40 milliseconds. So the duration is about 80 milliseconds. Okay, so all the criteria for normal sinus rhythm are satisfied. So this is normal sinus rhythm. When we say sinus bradycardia, so when we say bradycardia, brady means slow. And as we mentioned before, the normal heart rate is between 60 and 100 beats per minute. So when we say sinus bradycardia, we mean it is a sinus, the impulse is coming from the sinus node, the heart rate is less than 60 beats per minute. The P waves are going to be followed by a QRS every time. That's the definition for sinus bradycardia. So let's look at this ECG and let's look at the rhythm strip. Again, this is a 12 lead ECG. You put 10 leads on and you get 12, you put 10 electrodes on and you get 12 leads. This is lead 1, this is lead 2, lead 3, AVR, AVL, AVF. The ones with the A is what we call augmented limb leads, and these are the regular limb leads. These are your precordial or your chest leads, V1, V2, V3, V4, V5, and V6. This is your rhythm strip because it does not change leads. It just leads is all lead 2. So this R wave falls on this big block, and this R wave falls on this one. How many big blocks separates the RR interval? So you have 1, you have 2, 3, 4, 5, 6. So you divide, the heart rate is equal to 300 divided by the number of big blocks separating the RR interval. So it is 300 divided by 6, which is equal to 50. So this heart rate is 50 beats per minute. Bradycardia is less than 60. So this is bradycardia. It is sinus because the P waves in leads 2, leads 3, and AVF are upright. The PR interval is between 120 and 200 milliseconds. And if you look at the duration of the QRS complex, it is probably less than 2 tiny blocks, which is 80 milliseconds. So slow, less than 60, and it's sinus bradycardia. Tachycardia means a heart rate greater than 100 beats per minute, but each P wave is still going to be followed by a QRS. The P waves in leads 2, leads 3, and AVF are going to be upright. So let's look at this 12 lead ECG. Of course, you have the limb leads, the augmented limb leads, the regular limb leads. Okay, you can see that the P waves in leads 2, leads 3, and AVF are upright. This is our rhythm strip, and let's look at, say, okay, let's look at this one. You can see that this R wave falls on a big block. The next R wave is 1, 2, call it 3, or if you want to call it, yeah, call it 3. All right, less than 3. If it's 2.5, then you do the same thing. The heart rate is equal to 300 divided by the number of big blocks. So if it's 2.5, it will be 300 divided by 2.5. And that is going to be a number greater than 100. I mean, if you want to be exact, then you take out your calculator and you divide your 300. So it is going to be 300 divided by 2.5, and that is equal to 120. So your heart rate is 120 beats per minute. So the heart rate greater than 100 is tachycardia. Sinus because you have upright P waves in leads 2, lead 3, AVF. The PR interval is between 120 and 200 milliseconds. The QRS duration is less than 120 milliseconds. So it makes it sinus tachycardia. Sinus means that the impulse is coming from the sinoatrial node. All right, so we're gonna break here, and we our next session is gonna be Monday, and we will